Bars and restaurants closed.
Well, thank you, Mr. President, and good afternoon. With more than 2,900 cases of coronavirus in 49 states across the country, I want to assure the American people that this administration, all of our partners at the state level and local health officials have no higher priority than the health and safety of the American public. And at the President's direction, we will continue not only a whole-of-government approach, but as we'll discuss today, we'll continue to build on a whole-of-America approach to confront the coronavirus across the country. The health experts continue to confirm to us that based on the latest information, for the American people as a whole, the risk of serious illness remains low. But because the risk is heavily weighted to the most vulnerable, to people with immunodeficiencies and to people who are elderly with serious underlying chronic health conditions, our administration, and I know state administrations, will continue to focus on the most vulnerable, and we will continue to urge every American to be vigilant in practicing good hygiene, taking the advice of the CDC and local health experts to keep those most vulnerable safe. I know I speak on behalf of the President and our entire team when I say how grateful we are for governors all across the country and the seamless partnership that we have forged with them and with state health officials, with our federal team. I spoke today to Governor Pritzker of Illinois, and we are in continuous communication with governors a phone call away. They know that they can contact us and address even the smallest need, because as a former governor, I know firsthand that when it comes to health challenges in America, our states are on the ground in the lead, our local health organizations, and we've built a great partnership. We also want to express great appreciation to the American people. Not surprisingly, it is inspiring to see the way tens of millions of Americans are responding with compassion, with common sense, and we want to express particular gratitude to communities of faith that participated in today's National Day of Prayer. We've seen places of worship implementing policies to keep those most vulnerable safe, and also we're seeing communities of faith already stepping forward to support and to encourage those most vulnerable. I heard tell of a church back in Indiana that's actually no longer having services till April 10th, but in the meantime, they'll be offering daycare to the children of healthcare workers in central Indiana. And churches all across the country are taking the opportunity to reach out and put feet on their faith, and it's truly inspiring. As the President mentioned today, he spoke today to leaders in the grocery store industry and where people buy our food, and we heard and we're reminded that America has the most efficient and effective supply chain in the world, and it's working just fine. As the President said, he received a commitment from those grocery store executives that stores will stay open throughout the days that lie ahead. We were told that hours may be reduced to allow for cleaning and to resupply, but American families can be confident your local grocery store is going to be open, it's going to be well supplied, and they specifically asked us to encourage Americans just buy your weekly needs in grocery, because the grocery stores will remain open. Also, very movingly, those same executives all reiterated their commitment to continue to support local food banks in the way that our grocers continue to do around America. Tomorrow, the President and I will be briefing all the nation's governors, states and territories, and the District of Columbia. We'll be speaking about the progress that we're making, and we'll be speaking to them specifically about our widening partnership on expanding testing to the American people. So allow me to speak to that issue, and then I'm going to recognize Admiral Brett Kouar, who will describe for us the excellent work the Public Health Service is doing. Dr. Birx will describe the importance of the new national public-private partnership for diagnostic testing that is going to open the door the thousands of more tests in real time for the American people in the days ahead. First, some fundamentals. As the American people know, testing is now available in all 50 states. Either state labs are either conducting the tests themselves or the CDC is processing tests. They're using the traditional manner of a manual test that allows for 40 to 60 tests a day. It is among the reasons why the President several weeks ago tasked this group at the White House to reach out to commercial labs around the country and forge that public-private partnership that would bring the high speed, or more accurately, the high throughput testing for coronavirus available in real time. And based on the unprecedented speed of the FDA, which last week approved high throughput coronavirus testings for Roche and Thermo Fisher, we will now have access in the days ahead to more than 2,000 labs across the country that have the equipment today to process coronavirus tests much more rapidly and a much higher volume for the American people. In terms of delivering those services, more than 10 states, in addition to CDC labs, and public health labs, and labs that states can now authorize in their states, more than 10 states have implemented their own drive-through testing sites, and we want to commend New York, Colorado, Delaware, Washington State, Texas, and others that have implemented these on-site places where people can obtain tests. Most are using the current CDC testing, the manual testing, but we are working closely with our governors, as you will hear momentarily, to make sure that the new testing regimen is available for their remote sites as well. As I mentioned, as of Monday, we will have more than 2,000 labs coming online with the high-speed testing, and we are connecting states to those testing methods. We're also working with a number of retail partners to add to the work that states are doing around the country, working to set up parking lot testing centers outside of stores, and Admiral Brett Garrar will detail the progress that we've made over the last 72 hours. Following the President's declaration of emergency, the Admiral and our Public Health Service have forged a partnership now with FEMA, made possible by that declaration, and they've reached out to all 50 states to create a process that will enable all Americans who need to be tested to go to a community-based testing site outside of usual healthcare facilities. The focus of these tests, as Dr. Birx will describe momentarily, will be on those most in need. A priority will be placed on healthcare workers and first responders who are out there coming alongside people that are being impacted by the coronavirus. We want to make sure they have access to the testing as a priority. And then Americans 65 or over with a cough or a fever or other symptoms will be prioritized over other tests that are extended. As I mentioned, Admiral Garrar will describe the progress that we've made in just a few moments, but we're going to continue to work very diligently, hour by hour, day by day in the days ahead, to expand testing around the country and access to this extraordinary and unprecedented national public-private partnership for diagnostic testing. With regard to testing, as we expand testing, we're so pleased that Congress joined with our administration to make sure that cost is never going to be a barrier to anyone getting a coronavirus test. As you recall, several weeks ago, the President directed a change in our Medicare and Medicaid programs to ensure that coronavirus testing was included. Health insurers were brought in. They all agreed to waive co-pays, but because of the good bipartisan work done in the House of Representatives, now all coronavirus testing is free, and it's free for every American, including uninsured Americans. And we continue to urge passage of the legislation that will be considered by the Senate this week. Let me say one final word about the testing issue, and that is that we, as the President often says, we're all in this together. And it's absolutely important that as we expand testing resources across the country, beginning by prioritizing the areas that CDC and our state leadership tell us are most important. It's important that the tests are available for people that are most in need, and for our healthcare workers and first responders that are helping them and supporting them. As Dr. Birx will describe, the testing that is available should only be done if for any reason you think you may have the coronavirus. We encourage people to consult their doctor, and if you're symptom-free, we encourage you to work with us to make sure the testing is available for people that are experiencing symptoms. It's extremely important that we have the continuing cooperation of every American as we expand testing and make it available during this challenging time in the life of our nation. With that, I'm going to ask Dr. Birx, I'm going to ask Admiral Brett Giroir of the Public Health Service and leader of this great commission corps behind me, to come up and describe the extraordinary work that they have done over the last 72 hours and will be doing each and every day in conjunction with our states to expand testing to community-based testing across the country for the American people using this new public-private partnership diagnostic testing.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.